Okay, well, welcome to the Tahoma Clinic Podcasts. Sorry we're so far behind the times in getting podcasts out there, but that's just me. I'm not technologically inclined. I pay much more attention to medical research papers, and of course they're not electronic. So it takes me a while to catch up with stuff like this. First topic for the podcast is going to be how to reduce your risk of heart attack and stroke by anywhere from 45% to 88%. I am not kidding. That's from published research papers. Okay, now this applies to men of all ages, once they're adults, of course, and it applies to women who are postmenopausal. And I bet you can guess why it doesn't apply to women who are premenopausal, because how to get it done is to donate blood. And if you're having menstrual periods, why, in a manner of speaking, you're kind of donating blood. What donating blood does is reduce the thickness, which technically speaking, and we have to use technical terms from time to time, is called the viscosity. It reduces the thickness of the blood. Now, what the heck does that do? Before I get to that, I need to say thank you to Dr. Ralph Holsworth, who was with us for a number of years, and especially to Dr. Kenneth Kinsey, a cardiologist who I believe is no longer with us. It's Kenneth Kinsey, who wrote us a book explaining the origin of atherosclerosis. And atherosclerosis is just another word for arteriosclerosis, and all that means is clogged arteries. And Kinsey explained how arteries get clogged. Now, how arteries get clogged is simply that the blood becomes more thick. The thicker it gets, the more it abrades the inside of the arteries. And by the way, that blood thickness is going to happen inevitably unless we're having menstrual periods, because we're always making more red blood cells and we're not losing blood, are we? So this is also going to be mentioned in much greater detail in either the May or June newsletter, with lots of footnotes and references for people who are interested in that to the scientific studies. And what they tell us in there, especially Dr. Kinsey, is that thicker blood is more abrasive. And as abrasive, it literally inflames the insides of the arteries. And if the arteries get inflamed, then what does the body do to cover up the inflammation? Why, it pastes over cholesterol. Cholesterol isn't the bad guy here. It's just the plaster that's pasted over the inflamed area that's caused by the thick blood. And once again, menstruating women don't have as thick blood as men do, or as postmenopausal women. And that's why those are the two groups here that get to reduce the risk of heart attack and stroke by going to donating blood. And it usually takes 3 or 4 times a year, but my goodness, we've done ourselves some good because we reduce our risk of heart attack and stroke. For men, that study over in Finland was 88% risk reduction. And for men and women, and by the way, it was several thousand in both cases, for men and women here in the United States, a study also done in the 1990s, like the Finnish study, oh my goodness, it was a 45% risk reduction. That's good. It really is. If we donate blood, our blood becomes less viscous, less thick. It doesn't abrade the arteries don't get clogged as easily. And while we're at it, the blood is able to deliver more oxygen, which we could all use. And it's able to deliver more nutrients if our digestion is working, that is, and we hope it is. Cover that another time. Digestion has a lot to do with a lot of health problems, but that's for another time. We can prevent thicker blood just simply by blood donation. That's all it is to it. It's so simple. Now remember that blood donation dramatically cuts down on the cycle of injury. The blood isn't thick, it doesn't damage the artery walls, we don't get cholesterol pasted up to those artery walls, and therefore we deliver nutrients and so forth better.
So when you donate blood, you obviously are removing blood from your system.
Yes.
How is that? Is that blood regenerated with new, fresher blood, and how does that happen?
Yes, over time.
So your body makes its own
red cells, white cells, etc. Yes.
Okay.
All of that.
So you replenish yourself.
Which is why you have to do it 3 or 4 times a year to get it to really reduce your risk of heart attack and stroke. Now, if you want to, just go donate some blood. Won't cost you anything. And you reduce your risk of heart attack and stroke significantly. More for men than for women, but still significantly even for women. Remember that United States study, 45%? That's good. But if you want to be scientific and really check to make sure you need to donate blood, there happens to be a test called a blood viscosity test. And remember, viscosity just means thickness. Now, that blood viscosity equipment was invented in Korea, of all places, not here in the United States. And when I first learned about this from Dr. Holsworth and started applying it, why, I thought, oh, well, the laboratory I'm supposedly medical director for, Meridian Valley Laboratory, they could import that and do the test.
Import the equipment?
Import the equipment to
okay.
do the test. And they did, and it took about a year to get it done properly, I should say. That's been about 10 years now. They've been doing whenever somebody sends them a blood sample, they can do a blood viscosity test on it, and they can say, oh yeah, your blood is too thick, or no, it isn't too thick. That's if you care to get a test. Your other alternative, of course, is just donate blood if you happen to be an adult. Now, if you care to get a test, the place to call is Meridian Valley Lab, and their number happens to be 1-855-405-8378. That's 1-855-405-8378. If you want to get the test done, you get a note from your doc, and you go to a laboratory with that note, and that laboratory needs to be informed where to send the test, and then they will send you the results, and they'll send your doctor the results. That is Meridian Valley Lab blood.
So this blood viscosity equipment testing, it's all over the country, or is
no? It's only Meridian Valley Lab.
Only in Meridian Valley Lab. Okay.
Yes.
So even if you live in Wisconsin, you can send blood from your local lab there to Meridian. They'll send the results to your doctor. Is that
and to you too?
And to you. So, but there's nobody else in the U.S. has this.
Not presently. It was put together in Korea, and it does quite a nice job.
But it'll give you a range of how thick your blood is or is not, and whether you should donate or not, or
if you want to do testing.
Right.
Otherwise, just go donate blood.
So if your blood's thicker, does it make, other than not getting nutrients and what around your body, does it make your heart work harder?
Yes, of course. It has to push harder to get the blood through.
So the older you get, the harder it works.
Mm-hmm.
It can't possibly be a good thing. So
no, the older you get, the harder the heart has to work to push things through if you haven't been doing blood donation or having menstrual periods.
Right. Thank you.
Mm-hmm. Sure enough. So, the other thing is Dr. Kenzie's book, The Origin of Atherosclerosis. That's how it's spelled, Atherosclerosis. I think I got that right, atherosclerosis. Another word for it is arteriosclerosis, but he named it atherosclerosis. Who knows why? And if you're interested in Kenneth Kenzie, just go to a website that starts with all the W's like they all do, usebooksearch.co, not .com, .co.uk for the United Kingdom. They just happen to be based there, but in my experience over the last 20 to 30 years, that website is better at finding used books than any place else. And you put in the name of the author, and you put in the title, and you go click, and up comes about 15 to 20 different locations that have that used book on sale and exactly what the price is, and you just click there and go buy it from them if you feel like it.
So it's usebooksearch.co.uk, as in United Kingdom?
That's right. That's where they're based. Even though they have, what I want to say, they have clients worldwide that will sell the books.
Sir, even though you're on that website, your book may come from Colorado.
Oh, absolutely. Yes, sir.
Because somebody in Colorado wants to sell that book.
The last one I got was from Texas, of all places.
Perfect.
Through that used book search engine. And remember, the book is called The Origin of Atherosclerosis, not arteriosclerosis, and you can read all about it. And to do just a small recap, because for me it is really appealing, namely the research in Finland on several thousand men, 88% reduction in heart attack and stroke for men. Now, for the women, there's a study in the United States that combined several thousand men and women. And for the women and men together now, they didn't give separate statistics, it was a 45% risk reduction. So even that is definitely worthwhile, a 45%.
Still very significant drop.
Yeah, absolutely.
Do you have an upcoming article in your newsletter about this?
Yes.
May or June?
May or June.
Okay. So it'll be in the May or June Green Medicine newsletter.
For 2021.
2021. So even if you hear this podcast 3 years from now, you can go back and, because you have all those articles archived,
They're
right?
all archived, yes.
Okay, great.
But the big deal, folks, is we can do ourselves some good while we're doing somebody else some good.
Okay, blood donation.
There you go.
Helps you stay alive.
Longer and healthier.
Thank you, Dr. Wright. I appreciate it very much.
And thanks for getting this done.